We're here to discuss the challenges that family doctors face in our province and how these issues affect the patient care. The panelists with me today are Dr. Liz Callahan from St. John's, to my left, Dr. Jodie Wolfrey from Botwood, and to my far left, Dr. Wendy Graham from Port aux Basques. My name is Dr. Lydia Hatcher. I'm a family physician in Mount Pearl. I also do part-time emergency room medicine, and I am a former rural physician. I know the challenges that we all face daily in delivering quality healthcare to patients. In a healthcare system that's underfunded, poorly human-resourced, and geographically isolated, we all feel tremendous pressure. It's only because physicians going above and beyond what is considered normal for family doctors that we are able to keep the health system going and that the system works as well as it does. The current shortage of family doctors, coupled with our aging population that has increased rates of chronic disease, is directly contributing to prolonged wait times and the growing number of patients in the province who do not receive timely access to primary care when they need it. When a medical condition deteriorates because it goes untreated or the treatment is delayed, preventable suffering occurs, and ultimately the strain on our medical system worsens. I want to tell you just a couple of stories from my practice about access problems that I face and most of my colleagues face every day. I have a 37-year-old patient who's got diabetes and rheumatoid arthritis. She had a major flare of her arthritis, and I decided to speak to a rheumatologist to get her seen urgently. He said she would be put on the urgent list, and she was. She was told that she'd probably see the doctor within the next 3 months. I referred her in January of 2009. The second patient is a young woman whose mother had breast cancer at the age of 38. Her mammogram showed a lesion, and an ultrasound was recommended for follow-up. The urgent request was booked, and it was 3 months later that she got that ultrasound. Now, how would you feel if you had to wait 3 months knowing you've got an abnormal mammogram and your mom had died of that disease or had that disease at the same age that you are now? It's unacceptable. In the next 5 to 10 years, we expect about a quarter of our doctors will retire. If this occurs without a corresponding investment in primary care, we can expect to see even longer wait times and a growing number of orphaned patients in our province who no longer have access to family doctors. The NLMA estimates at least 100 additional family doctors are required to ensure our patients receive the appropriate level of care that they need and deserve. I'm going to turn it over now to Dr. Callahan, who's going to discuss the challenges of operating a closed, busy urban practice, followed by Dr. Graham, who will be focusing on the management of complex patients in a rural practice, and Dr. Jodie Wolfrey, who will then discuss his experience as a rural practitioner and the constant challenges of physician turnover. After each panelist has made their statements, we will open the floor to questions. So I will turn over now to Dr. Callahan.
I'd just like to talk a little bit about what general practice means to me and how much it has changed in the length of time that I've been in practice. I started practice in City Centre in St. John's in September of 1979, so this year I will be in practice 31 years. When I started, my children were young, and I worked generally from 9 until about 4:30. I did do deliveries, so I was called out from the office and also from home on numerous occasions, but my time in the office was fairly steady each day. As my children have grown older and gone through university, I find, like most family physicians who have been working for a long period of time, my practice has grown, and the length of time that it takes me to look after this practice has also grown. When I was preparing what I was going to say today, I sat down and thought about the hours that I work, and I never really spend a whole lot of time thinking about that. But when I sat down and wrote it down, I thought, I get up in the morning at 6 a.m., I go to work at 7 to try and catch up on paperwork that I cannot keep up with during my regular hours. I see patients from 8 until 5:30. I spend an hour then cluing up the paperwork that has come from that day's worth of seeing patients. I go home and have my supper. At least one night a week, I go back to the office for 2 or 3 hours to again complete paperwork. Weekends, I spend at least 4 hours either Saturday or Sunday doing paperwork. So when I sat down and thought about it, I realized that I spend one full extra day a week doing paperwork. And that's not paperwork meaning writing up patients' charts. That's extra paperwork that comes in. Letters that I have to write for patients who've had accidents, forms that people need filled out for sick leave, long-term disability, Canada pension, income tax disability, the list goes on. And I was quite surprised when I realized how much time has evolved that is required now for me to look after my practice. And as I go through this, hopefully I'll explain why that has happened. In the last 30 years, I find that family practice and providing that service to patients has changed remarkably. When I first started in practice, the Grace Hospital was in operation, and if I had a problem with a patient that I saw in the office, I picked up the phone, I called somebody, often at the Grace because it was the closest hospital to me, and whatever was needed was done. A half an hour later, I called down and I got a report. The fascinating thing is that over the last 30 years, the technology has improved significantly, but unfortunately, the access to that technology has not kept pace. And again, as I go through, I'll describe situations where rather than picking up the phone and making one phone call, it takes half a day to now accomplish what I used to be able to accomplish in one phone call. The other big change when I sat down and thought about it is the fact that years ago, every June when medical students graduated, we had an influx of new doctors right through the island, but especially in St. John's. We had new family physicians who started up, and we had new specialists who started up. So if you had a problem getting a patient in to see a particular specialist, you knew that in June that problem would be solved because new specialists would start, they would be anxious to take new patients, and you would have no problem for that first couple of months getting your patients seen. Over the last 10 or 12 years, we've not had that influx. A lot of the specialists and a lot of the family physicians who are graduating are going to other provinces or to other countries. And when I sat back and looked at it, I thought in some specialties, I can't remember the last time we had a new specialist start up. So when you're looking at what is causing the problems, that's a major thing that causes problems. When years ago we knew we would always have somebody to fill the void, and now for years and years we've had areas where we've had no new specialists, and obviously the specialists that are here are all working very hard. But if you've been in practice for 4 or 5 years, you don't have the same ability to take on patients that family physicians are calling and referring to you.